Hi, my name is Emily Iannelli. I recently had transgender surgery, SRS, bottom surgery, on September 11th, 2019. What a day. It's been interesting and, something I've been waiting for, hoping for, dreaming of, not sure if it really would come to be. I attempted this surgery 6 times. Many of my prior attempts were for reasons regarding my health, regarding my mental issues. I was, needless to say, disappointed, but I realized that it was in my best interest to have those surgeries canceled or postponed. There are reasons, I have to be in the right state of mind for such a invasive surgery. I've been struggling emotionally. I have, depression. I'm raising an autistic son who I love dearly, and is a young man now, and it's hard. We have to make some real difficult decisions for his future, but it's, looking at my son's best interest. But he's our only child, and it's difficult to have to come to terms with that reality, but that's part of life, and I need to make sure he will be okay and protected. So I had my surgery, and it's no picnic. I'm happy, I feel complete, but it's no picnic. I'm not gonna lie and say, oh, I feel wonderful, it's great, it's the best thing I could have done, because, it's something that I wanted. It's all anticlimactic. I, didn't really know what to expect, but I had good surgeons, very highly qualified surgeons at Mount Sinai, Beth Israel, Dr. Rajveer Purohit, and his colleague from Serbia, another very well-trained surgeon in this field of transgender surgeries. So I've been fortunate. I even had a surgery scheduled prior to this with Dr. Marcy Bowers, who also is a transgender woman postdoc, and she's a medical doctor, surgeon, highly qualified. Dr. Jess Ting and Dr. Purohit Rajveer, who did my surgery this sixth try, along with his doctor, surgeon colleague from Serbia, as they said. They both were wonderful. They came up and visited me. They treated me with dignity and respect, and they were very sympathetic and compassionate towards my situation. It's not an easy road living as a transgender identified person. I'd be lying if I told you it's the greatest thing in the world, because it's not. I've lost many friends in the process of my transition. I lost job because of transphobia. I lost friends because of transphobia. My family sticks by my side. I have some really good friends who accept me and treat me with dignity and respect. And I find that's very important in my life. I knew when I was young I was different. Took me a long time to come to terms with that. I suppressed and repressed all my feelings growing up. Couldn't speak about it. It was difficult. Plus, I grew up in the early 60s. I was born 1961. And 3 presidents were my presidents in the first 2 years of my life. 3. Dwight Eisenhower, 2 days. Our beloved President John F. Kennedy, who tragically was assassinated. Coming up is his anniversary of the tragedy. And Lyndon Baines Johnson, who was President John F. Kennedy's vice president. He took charge in the aftermath of that sad tragedy of President John F. Kennedy's assassination. So I've grown into the person I am. I've always knew I was at some point in my life having to address this matter. So now the surgery, it was invasive surgery, but I had wonderful doctors and nurses and professional hospital trained individuals who helped me, and I didn't have any issues, plus the anesthesia worked. And when I woke up, I felt somewhat elated, a little bit surreal. I thought this whole experience was surreal. It was just, you don't know what to expect. And I feel it was something that I had to do, and I'm happy I did. And my lifestyle hasn't and will not change. I'm devoted to my wife and my son. It's difficult though, because I understand the reality of my son's situation. Autism is a very difficult thing to have to see your child deal with. I was 3 when I knew I was different. Didn't know why, but I just felt different. My son was 3 when he was diagnosed with autism. We both had have our struggles, And I'm grateful that I have supportive individuals in my journey of living and becoming a woman. And I'm happy. Would I want to do my life all over again as a woman, born female? No, not necessarily, because I have my family, my son, and if I did surgery before I met my wife, my life would not be the same. I'm blessed to have my wife and son. Life is hard though, life is difficult, and it's going to be tough when we eventually will have to come to terms with the reality that my son most likely will be in a group home. People tell me, this is the best thing for him, and I agree. And they said, our children have to grow up and move on. Lots of my friends' children already are college educated. I was hoping that Matthew would find something he enjoyed so he could go to school. We want to see him do something that he feels comfortable with. We want to see him happy. My son means the world to me, and my wife too. If it wasn't for my wife, I would not have the health care that I've been blessed with to help address all my issues mentally. And it's been a difficult road to travel, but I'm grateful for my family and my friends that are stuck by my side throughout. And so after surgery, I didn't know really what to expect. but I do now have, and I'm only going to say it one time, I don't need to keep emphasizing it, but medically now I have a vagina, and you know, I'm technically now considered a woman, even though in my mind, heart and soul, I always felt like a woman. I have no regrets. I'm just really feeling better. I feel complete. I feel whole as a person. You know, I have no ill feelings to how I was born. I was a young boy and I grew into manhood. I met nice people in my life. I was blessed to have athletics and academics to help me and guide me in my life. Great teachers, great coach, great friends, great teammates. As a track and cross-country runner in high school. In fact, we celebrated our anniversary and celebration for our coach on July 28th of this year at Sacramento State Park, and I got to hang with a lot of my cross-country teammates. A good amount were in my graduating class of 79, where we're celebrating our 40-year anniversary of graduation, and I'm going to that party or celebration as well. And I believe that celebration should be reserved for the honor of our high school classmates who have perished, who are no longer with us. I think it's important that we recognize them, and we are a far less better place without them. But that's the life cycle, you know. We're born and eventually we die. That's the reality of life. Am I afraid to die? Of course I am. I'd be lying if I wasn't. And it's a reality, you know. That's why, that was one of the reasons that motivated me to finally do surgery. It was my 6th attempt. And they were trying to make sure it was going to happen up until the last day, basically. My surgery was again in doubt, because unfortunately I have problems with my liver. I have liver disease now. I have to focus on that. And now my son too. And it all has to do with our medication regimen. I've been crashed off most of my meds. I'm on very limited amount of medications, and it does affect me at times because I don't have my antidepressants anymore. And I need that because I do have bipolar disorder and I have depression. I'm also transgender identified, and if you ask me, I think my depression stemmed also from my transgender struggles. I believe that I'm depressed for other reasons, but I feel that my depression and my transgender struggles are intertwined with each other. How could they not be? You know, it goes hand in hand. When you're not feeling true to who you are are mixed up and you're sad because you thought you should have been female, and you see girls dressing and going out and living life and so pretty, so nice, so cute. And here you are, a crazy mixed up teenager who doesn't know what the hell's going on, growing up as a child too. You know, it was a difficult road for me. I did not have the ability to transition early in my life, but like I said, I wouldn't trade my situation for the world. I mean, I could do with a lot less hospitalizations. I could go into my life and look at things that affected my struggles and depression, but I don't feel like going there. It's too upsetting to me. Life is struggle. It's the reality is we're going to face many hardships in our life. I lost my parents. I'm sure most of my friends would be very sad when their parents expire, die, however you want to say it. For me, it was very difficult, but I had to come to terms with that. You know, I lost some high school friends that I knew growing up, and they're no longer with us, which makes me sad. So, with all this said, as a transgender woman and having surgery, I'm kind of, I feel it's somewhat unreal. It's surreal that I'm a post-op transgender woman now. Post-op. I was pre-op for most of my life, and now I can say I'm a post-op transgender woman. And I'll be honest with all of you who plan to have surgery, who are looking forward to surgery. It is a good surgery if you're trans and you know and you feel that you need to be whole. Medical science has allowed us to be able to become the gender that we identify as, so the mind and the body match, you know. And my team of doctors, surgeons, and nurses were wonderful. You know, they made this dream of mine, my need fulfilled and happen. You know, if it wasn't for them, I wouldn't be where I am now. But I have struggles. I still have the same life that I had before surgery, and I'll have the same life after. Now, for what happens in the aftermath of surgery. I was in the hospital roughly 4 to 5 days, including the day of my surgery. And I had good doctors and nurses, a whole team that would come and visit me each day. Made me feel good. They were checking up on me. I went home with the catheter. I was giving instructions on how to use specific, it's hard to talk about it, but there are things you need to do after surgery to maintain your you know, the body. There are areas that now you have to address. My hygiene certainly has improved tremendously. Now I find as a female that I'm more in tune with my body for many reasons. I don't have the same attitude as a male. My definite female transition has changed my perspective on life, especially after surgery, because my hygiene has changed significantly. I find that I need to take a shower every day based on my aftercare, my post-op things I must do. We all will face that if we go through with surgery. There's a lot of things you must do after surgery for a transgender woman. Post-op care and maintenance. I have visiting nurse agency that come once a week to check up on me, make sure I'm doing everything properly. I have frequent doctor, surgeon visits. In fact, next week I'm meeting again with my surgeon to make sure everything's in order and that I'm doing what I'm supposed to do. I've been stressed. I've had friends say, you better slow down, kid, because I'm trying to jump into my life. I've had trauma recently. In January, I attempted suicide, I'm not going to lie. I overdosed on medication because I have had a lot of stress in my life. I want to live a normal life, relatively. And I want to be respected as a person. When I came out, it was a difficult situation because I came out in my early 50s for various reasons. And for me, my life turned upside down when I came out. It was not a smooth transition. It was a rude awakening, in fact. I didn't realize how much I was going to have transphobia in my life. I was naive, innocent. I thought everything was going to work out and everything would be smooth sailing when I came out, but that was not the case. It was very difficult. And preparing for a life as the person you identify as, you would think it'd be much easier, not such a hardship and difficult thing to have to go through, you know. And because of that, I got mentally ill, mentally sick. I believe that's part of my life anyway, regardless of coming out. But I managed. It was hard. I cross-dressed basically all my life. I would like to eventually try to impart my own experiences in conversations, even try to speak in front of people, you know, in a arranged, orchestrated visit where I could talk and share my own personal experiences for the LGBT community. I think I have a lot to offer as to my experiences. So after surgery, you must realize there's aftercare, there's maintenance you must do every day. And if you don't, it's gonna not be good, because you have to stick to the regimen. You have no choice, you have to. And I'm getting used to it. It's a bit hard at first. I won't lie, it's painful, you know, it is. That's why they give you painkillers, oxycodone, and antibiotics, just to to avoid getting infection. The daily maintenance and routines that I must stick to is not easy, but it becomes adaptable, you know, once you integrate this into your daily life. Plus, for health reasons, you have to be much more in tune with your body's needs. Your hygiene has to increase significantly, your habits. When I was a guy, I didn't really consider hygiene one of my areas of priority. As a female, it's a very important part of your life, and you must be very conscious of that. I've never been in tune with my body as I have after surgery. I find that I'm much more in tune with my body. I have no choice, I have to, and I don't mind that because it's a good thing. And it also gives me time to reflect as I'm doing my aftercare maintenance. It allows me to find some form of comfort, you know. I listen to my music when I'm going through the routine that I must stick to daily. The music helps me, and I do what I have to, every day now. I've been stressed, and I'll be honest, I haven't stuck to that regimen completely, but it's a necessity to do so. There are friends of mine who are concerned about my recovery and things I'm doing. They think I need to slow the hell down, slow the heck down. I have to recover properly. So I'm working on that. I will be doing much more I have to stick to a regimen. I can't overdo my things because it's too stressful for the body and the mind. So I am getting used to it. Do I feel any different? Not really. I'm not nonchalant about the surgery. I'm grateful to my team who've got me through this. I see my psychiatrist and my therapist, and I see my surgeon. Now I have to start going to my other doctors regarding my liver issues. And my son, I have to get him into seeing a liver doctor as well, because it is based on medications that I had to come off. The only I was taking Depakote for my bipolar disorder. I was taking risperidone. I was taking Seroquel. I was taking Lexapro, Latuda, so many meds, I can't even remember them all. But now I'm only on a few. I'm on, and spironolactone and estradiol, of course, HRT. After surgery, I do not have to take spironolactone because I don't have the working parts of a male anymore, which would be the source of testosterone, so I don't have that. So I don't need spironolactone. If you're a transgender woman, basically the HRT for me, in my case, consisted of estradiol, which is female hormone, and spironolactone, which is a testosterone suppressant. Since I don't have testosterone now in my body, I don't need the spironolactone, but I need estradiol for the rest of my life. And it's only a small little pill. I take 3 every day. And it's a tiny pill, but it really changes your whole body. I have breast development. My skin is very soft. My body fat has redistributed in areas that are more consistent with a female. My skin is very, very soft to touch. I'm growing my hair out, which helps in my appearance as a woman. Obviously, I wear dresses, so there's no question as to who I am and the gender I identify as, which is a female. I identify as a woman, and I'm happy. I am a father though, and I always will be. I am a husband, and I always will be, but in my gender identity, I'm a woman, plain and simple. Even before surgery, I knew I was a woman. Post-surgery only allows me to now have a body consistent with my mind. The aftercare maintenance is not so bad once you get used to it, but it takes some time. I'm not even 3 weeks post-surgery. It seems like I've post-surgery over a year now. That's what it seems like. Almost 3 weeks, and it seems like a year. I'm happy, I have a monotone voice, but I'm very happy. This was something I knew I had to do over time when I was ready. I tried many times before, and this my sixth and final attempt. If I had surgery or I didn't, this was it. So there was a reality that almost not been able to have the surgery because of my liver. But my surgeon pushed for it, so they had to change hospitals. Usually they do these surgeries at another facility within Mount Sinai. But given my health situation, they had to have the surgery at Mount Sinai Beth Israel Hospital. And because they were able to change, that's how I was able to do the surgery. If they couldn't change hospitals, then my surgery would have been postponed or canceled, and I would have just walked away and said I tried, but it wasn't meant to be. But it was meant to be because I had the surgery. I was able to go forward, and my doctor, my surgeon, was very happy for me because he knew my struggle in his office. The girls in his office also knew, and they were rooting for me to have the surgery. And I'm very pleased with the results. And basically, if you plan to have surgery, you basically need to speak with the surgeon. Obviously, they will give you all the information you need once you have the surgery. And, it's a learning experience, it's a whole different perspective of life. You kind of feel like you had lived two lives, basically. Most of my life as a male, and now as a female, even though I identified as female all my life, basically. So now I know what it's like to be on the other side of the fence as a female. There are limitations when you transition from male to female, obviously. Because technically I am still male, though my body looks like a female, but I don't have all the working parts that a woman has. I don't have a uterus, I don't have ovaries, I don't have I didn't have the bottom. I didn't have any of that before. So they can do the surgery so you resemble a woman, but they can't do surgeries that allow you to have babies, or to, if you're young, to have periods. But women think that we're better off, at least in my case, when I said I wish I could experience everything that a woman experiences, including menstruation, and they said I'm crazy to want to go through that. So I guess in a way we're luckier, and giving birth is no picnic. I know from my wife's having Matthew, but a lot of transgender women want to have the full experience of living as a female, everything. I kind of would like to as well, but that is not going to happen. Plus I'm of age now where I would have menopause anyway. So most likely I wouldn't be able to get pregnant if I had all the body parts because of my age, 58. I certainly wouldn't have a period because that's far beyond menopause age. But I've come a long way. And I'll tell you this, if you're transitioning and you plan to do surgery, you must do a lot of soul searching. You must start getting into therapy and seeing a psychiatrist, and preferably someone who's knowledgeable of gender identity, specifically male to female gender identity. And then you start the process. And if you can get through that, living 2 years full time as a woman, staying on a regimen of HRT, for me, which was estradiol and spironolactone. And you have to do it every day. And then post-surgery, you have to do a lot more than take your estradiol. A lot more. Even before surgery, I still resembled a woman. After surgery, I resemble a woman. So, and it's cool. I like it. I didn't do it for any other reason but to feel whole as a person. I know a lot of transgender women who now have boyfriends and eventually get married and become wives or brides, and that's their dream. For me, it's really not, I'm not really, I didn't do surgery for that reason. And no transgender woman would say that she did it just to have a boyfriend, So, but transgender women now can have boyfriends, and they can have sex with men, just like any woman can, but they can't get pregnant. So if you have a relationship with a man, you have to be honest if he wants to have family. And that's hard to do, to come out to a guy who you have feelings for. A lot of transgender women do start having feelings for men. Me, I don't really care. I'm not interested. But I appreciate friendships with men and women. Doesn't matter to me. You can be my friend, you could be a guy, you could be a woman, for all I care. As long as you treat me with dignity and respect and don't expect me to do things that I'm not comfortable with. I'm not going to go into it. It's not necessary. But you know where I'm coming from. And once you do have surgery, girls out there, transgender women, prepare for changes in your life. Prepare for a complete turnaround as to how you do hygiene and maintain proper hygiene. Because now you're doing it as a woman. It's far different than as a male. There's a lot more involved. Do I miss my male anatomy? Not really, And I think that some transgender women don't need to do surgery because they get along okay with their body. For me, it was a struggle. But I know it's weird, but I know some transgender women who swore off that they would never have sex with men, that they were only interested in women. And I find it a little bit humorous that some of my transgender women friends who said no way would they ever embark on a sexual relationship with a man. They said no way. And yet, now they have boyfriends. So you tell me what happened with those girls. And I would only suggest that now they have anatomy of a woman consistent of a female. And they feel it's time to experience sexual relationships with men, just to experience the full experience of being a woman. So I guess I can understand that. For me, I am married and I'm committed to my marriage and my son. But if I was alone, didn't have that which I'm blessed I do, then maybe I would have relations with men sexually. But I'm not interested. But if I did, the surgery wouldn't be the reason to do such a thing. I'm not gay. I didn't do the surgery to hide behind my gay sexuality, because I'm not. And that's what bothers me, that a lot of people who don't know what it's like to be transgender automatically assume you're gay, and that's not true. There's a big difference between gender identity and sexual preference. Sexual preference for a male who likes a male for a relationship and sex is gay, homosexual, or lesbian. And I was never that way, and I'm not saying or judging people who are, because I respect all. I respect all within the LGBT community, LGBTQ, and others. Even people who are not transgender identified, they're cisgender. So, it's interesting. My life has changed and I'm happy. I'll always be happy, because now I am happy. And I was happy when I was a guy, but I was confused. I won't tell you that it's something that has dramatically changed my life. It all has to do with up here, what's up here. And what's up here is that I identified as a woman. So I did surgery for a reason. And I guess I'm starting to realize how difficult it is to be a woman. It is not easy. It's not a picnic. It's not a piece of cake. But it is something that you need to think about before you do it. Because once you do, there's no going back. And you have to be prepared up here mentally for that. And I'm not going to lie and say this is a cure-all.